Hi, Mrs. Blake. Hi, Mr. Pugh. How are you guys doing today?
There is a stigma out there. I'm just trying to let the people who feel like they don't have any hope and don't know where else to turn know that there is another way to get your life back.
Let's just do a little bit of memory testing here.
Okay.
So I'm going to name 3 objects: apple, table, and penny. Please try your best to remember those, okay? Because in a few minutes I'll ask you for them.
My name is Janice, and I've been coming to UT Southwestern for electroconvulsive therapy for several months. It was approximately 26 years ago that I was diagnosed with bipolar disorder. I went to different doctors. I tried every medicine there was, and in the past, it had always pretty much worked and brought me back to normal. But this last time that the medicine quit working, they were unable to find a medicine to bring me back. I just totally went off the deep end. I had even thought of suicidal thoughts and even how I would do it. Lucky for me and for my family, my son had a friend who had had ECT and it worked for her.
Largely, we are treating treatment-resistant depression and depression that can be associated with a number of psychiatric diagnoses. We work with an anesthesiologist, and then we stimulate the patient to have a seizure under anesthesia. Generally, we start to see some response 6 to 7 treatments in. Our desire is to get somebody to full remission.
It did save my life.
From then to now, it's remarkable. It's just remarkable. This is my sister. This is the way she's supposed to be. She's back.
When it comes to ECT, UT Southwestern is one of the prime centers in the country providing state-of-the-art treatments. In depression, brain is in a hyperactive state. With ECT, it helps to let it settle down. The treatment which are provided is less than 5 seconds. Beep, 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 and that's all. This may last up to 45 to 60 seconds, and then the patient gradually wakes up.
This is going to be the tools that we use to administer the stimulus that causes you to have the seizure.
When it comes to research associated with ECT, we have been in the front line. We need to understand how it works, and we also need to understand how we can avoid some of these side effects associated with ECT. The next evolution of this form of brain stimulation treatments is magnetic seizure therapy. Magnetic seizure therapy is very much like ECT, except the stimulation is provided by magnetic fields. We have done pilot studies to show that there are much fewer memory or neurocognitive effects associated with magnetic seizure therapy. That will be a major step forward. Maybe there will be a day that MST will be available to our psychiatrists, and MST will be one of the frontline treatment available for this severely depressed patient population.
Now, how about those 3 objects I asked you to remember earlier?
Apple, table, penny.
Very good.